Hello. Thank you for signing up to be a judge for the third annual Missouri Area Health Education Centers Interprofessional Collaborative Case Competition. All right, this year our judges come to us from a diverse range of disciplines, including education, both undergraduate and graduate, some directly related to the healthcare field and others, medical, nursing, physical therapy, laboratory science, and respiratory therapy. Here's a timeline for the case. So on the 14th, the students will have all their videos submitted. I actually received one already. That was early and a sweet surprise. Judging for you guys starts on the 18th and it'll finish on the 24th. And then on the 25th, we'll be having a Zoom virtual award ceremony for them. And that looks like it will be a lot of fun. All right, now we'll talk a little bit about the case. The case this year was actually created by Missouri healthcare professionals and revolves around a young man named Joe Smith from Potosi, Missouri, who gets his arm and hand stuck in a hay baler and is dragged. He loses part of his finger, need to be amputated. And it's kind of a shame. He really enjoys playing the saxophone in the high school band. And the students are tasked with putting together a team-based patient-centered care plan and sending us a video, 5 minutes and 7 minutes of length of what that looks like. Hop over to the actual case itself real fast. And I'll put a link to this into the email with your logins, but really quickly. So yeah, so Joe Smith plays the saxophone in the high school band. He's active in church and mission trips, and was admitted to the hospital for trauma to his right arm and hand, open double fracture and crushed hand. He had to have the dorsal index finger amputated. EMS reported he had got it stuck in a hay baler and it was dragged approximately 30 yards while his father was driving. During his hospital stay, Joe acquired an infection and will also need treatment for that upon release. So along with that, we have notes starting with the EMT who arrives on scene, nursing notes that begin at admittance to the emergency room through discharge, a care manager's note, which is quite extensive, a discharge letter from a physician, also a note from his orthopod, his occupational therapist, pastoral care, and his school counselor. We offer a number of other resources for the students in the case. So this is all links to information about things like the hospital in the Potosi area, what home health is there, their high school. I found the Amputee Coalition, this Naked Prosthetics are pretty cool. They actually make little prosthetics for fine motor skills. I didn't tell the students that was in there. I don't want to kind of give those little tips away, but they definitely have tons and tons of information at their tooltips. We also include patient education that comes out of our health science library, specific to the injuries and the medications used to treat the hospital-acquired infection. So just really wanted to talk a little bit about the case itself and what it looked like. I'm going to move on to the team assignments real quick, and then I'm going to stitch in to the video the part about Canvas. And there we should be about done. So I find this really amazing. I'm going to pop out this spreadsheet. This is the actual teams. They had to all submit team names. You can see here where we had our 2 teams that kind of disintegrated for time. We've been able better this year to track that type of data, the who, what, where, and why, which is really nice over a couple of years. It's always a shame to lose students to attrition. And we're working on all we can do to make sure that doesn't happen again in the future. So it's really amazing when we see that we have some students that actually signed up as a team themselves. So this literally could have been enough students from Idaho State University. They're all also AHEC scholars from that state. But really, when we were assigning teams, sometimes people could sign up as individuals, and we create a situation where you have people from Florida working with people from Idaho. We have people from Southwest Missouri working with a student from George Mason. It's just really kind of an amazing thing, and I wanted to just point that out really quick. It's definitely been a lot of fun, and we're learning a lot and getting really wonderful feedback from the students. All right, so now on to a little Canvas tutorial. So how judging works: you'll be sent a Gmail account and a password, which you can use to log into Canvas, which is a learning management system where we house the videos and this survey that you'll need to fill out. So the grading survey is 8 questions. You'll rank them from 0 to 3. We also provide you with a rubric, so you have an understanding of what was expected from the student. All right. So after you log into Canvas, you come to a page that looks like this. The teams will have their presentations listed. You pretty much just click on a presentation. You view the video, click next. Now this is my account from last year. The survey will be there. We'll just take a look at it really quick. Here are the questions, grading rubrics here. Answer those questions and then move on to the next video. It's pretty simple. And again, there's a whole week of grading, so you could do that in your spare time as you need. We try to make it as flexible as possible. And again, thank you.